From day one, we had one goal. That was to get him home.
We are suffering, and our kids are suffering, and it's unfair.
It's terrible. It's really heartbreaking.
We need help.
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 We need the help.
You're about to meet some of the most medically fragile people in the state. Some have traumatic brain injuries. Others have chronic, life-threatening diseases. And others need a respirator to breathe, simply to stay alive. The question is, where's the best place to care for these people? In a hospital or in a long-term facility like a nursing home? For many, the answer is neither. Research shows the best way to care for them when possible is at home with the help of in-home nursing. 13 Investigates is going to show you why, for thousands of Hoosiers, that type of care is simply not possible. Their home nursing care is approved and even paid for, and yet they still can't get it, leaving many of our state's most vulnerable residents gasping for care. This is the Bowling family.
Oh, yeah.
Natasha and Shane have 4 kids. They're all adopted, and they all have special medical needs. That's Sammy. He's 3, and he has arthrogryposis. It's a disease which impacts all of his joints and muscles, making his bones look kind of curved. Xavier is also 3. He has cystic fibrosis. Doctors had to remove half of his small intestine at birth.
What are you doing?
Rava's the big sister. She's 11. Rava has cerebral palsy and epilepsy. She's deaf, and she's also blind. And then there's 6-year-old Elias. Cardiac arrest when he was a baby left him with severe brain damage. Every breath he takes is thanks to that respirator. That's the sound of lunchtime. Most of the Bowling kids rely on liquid nutrition, taken through feeding tubes in their stomachs. Not exactly what you'd call your typical family, but one of the most beautiful and loving families you will ever meet.
What are you saying, huh? Other people say, I don't know how you do it, but you do it. Because they need it, so you figure it out.
I'm just hooking it back up to her because I moved her. You have your ups and downs, but it's all worth it.
Feeding tube.
You're giving them a better life.
We have a ventilator. I always tell people we have a mini ICU in our house.
The big challenge for these parents is how to provide constant medical care. Literally around-the-clock care 365 days a year. Elias needs someone nearby at every moment.
It's a matter of life and death.
Yes. His machine breathes for him. If he moves his arms and knocks it off, or if his trach comes out, he will die in 2 minutes.
Despite the medical challenges, doctors say these children can be at home. And that, of course, is where their parents want them. To meet the kids' medical needs, the Bowlings get some home nursing care during the week.
What are you doing?
So Natasha can work a day job and Shane can work at night to pay their bills. But they do not get nearly the amount of home nursing care the state has approved. In addition to daytime nurses, the Bowlings qualify for respite care. Nurses on the weekends and evenings so they can go to the grocery store or pharmacy or just have a little downtime. They're approved for 180 hours of home nursing respite care every month, 180. But instead, they get 0, as in none.
Right, because there's no nurses available.
Just how bad is the nursing shortage? Well, Elias is supposed to have an overnight nurse with him 7 nights a week, so Natasha can sleep while Shane's at work. The state Medicaid program has approved and even agreed to pay for that nursing. But a nurse comes just 2 nights a week, not 7. The other 5 nights, Natasha sets her alarm to go off every few hours to give Elias his medical treatments. And she sleeps right there, on the floor of his bedroom.
He is on life support, so I sleep right here so I can get up at a moment's notice and help him. We're lucky because we have nursing, at least. There's a lot of families that don't have it.
Like the Wright family. That is Taisha and her 1-year-old daughter, Desire. Desire was born almost 4 months early. Her lungs needed a lot of help, so in the hospital, she got a breathing tube and a ventilator. She was allowed to come home from the hospital because the state Medicaid program approved Desire for 18 hours of home nursing care every day.
The moment we left the hospital, we were supposed to have a nurse.
Did that ever happen?
No.
No nurses?
Nope.
Why?
They said they don't have any available, or they're not trained, or the waiting list is so long, they just don't have them.
That was 8 months ago, and still no nurse.
How can I help you?
Hello, yes, good afternoon. I was calling, I spoke with somebody a couple weeks ago about getting a nurse for my daughter. I haven't heard anything back, so I was just checking to see what was the status.
Taisha does not like taking no for an answer.
I know right now at this point I don't have any additional staffing.
Every week, she calls up and down this list of home nursing agencies to see if they can provide the care that her infant daughter is supposed to be getting. Nursing care already approved and funded by the state and by Medicaid.
Thank you for calling Tender Care. This is
Maria, how can I help you?
Hi, good afternoon.
Tender Care is one of the agencies on Taisha's list. Staff members there have been trying to help Taisha for weeks.
Tell me a little bit about what type of hours you're looking for and days.
But every time she calls, it's the same response.
As of right now, there hasn't been any changes.
We will absolutely hold on to your information and then let you know.
Okay.
Thank you so much for calling. I'll be back in touch.
We don't have staff available.
Tomorrow?
No. No, not likely. No. And I can't take her if I can't provide any care for her.
So the round-the-clock medical care Desire needs falls completely on Taisha. And make no mistake, it's a full-time, all-the-time job, which means she can't accept another job, like the full-time staff position she's already been offered at this downtown hotel.
If we can't work, how are we supposed to survive? Not only can I not work, I cannot support the kids, my household, my bills. The only option that they give us is to basically give our kids up to a facility. And it's not that we don't want them, it's that we need the help.
So yeah, it's heartbreaking when you see that these families are in crisis and you can't help them.
Leslie Deichman owns Tender Care, one of the many home nursing agencies across the state that must turn away families now looking for in-home nursing.
And since January, we have declined 200.
How urgent is this problem?
It is as bad as it can get. They get approved for these hours through Medicaid. When you get that news, you've got approved and you're going to get care. And then she says it's kind of like having a lottery ticket that you can't cash because there's no one to take you.
This is what we do.
So why are there not enough nurses? Well, there is a nationwide shortage, but here in Indiana, there's a lot more to it than that. Most seriously ill patients who get home nursing care get it through their state Medicaid program, and each state sets its own Medicaid reimbursement rates that really determine how much a nurse gets. The rates here in Indiana make home nursing look pretty unattractive. Here's why. A licensed practical nurse who works in home health care can make about $19 an hour. That same LPN in a nursing home can easily make $25 an hour or $27 an hour in a hospital. And those places usually offer much better benefits. The impact of that is very real.
Thank you for calling Tender Care. This is Maria. How can I help you?
This one home health care agency alone says it's lost more than 100 nurses who left because of the state's low reimbursement rates. And finding new nurses to replace them is nearly impossible.
So when they come in to interview and you tell them we can pay you $18.50 or $19 an hour, they're like, well, I can't live on that. You know, I'm making $25 at the nursing home. You just can't compete with that.
Next, I want you to see how all this impacts the nurses who are working on the front lines. Have you thought about leaving to find more money elsewhere?
I have. I mean, sometimes it keeps me awake at night.
And later, see how perhaps the biggest impact of all this is on the people who can't even talk about it.
What happened?
She started having seizures. Right before we got to the hospital, she stopped right there. So they had to do CPR.
Imagine being a licensed nurse for over 3 decades, literally helping to keep patients alive, only to make less money than you can make cleaning houses. Most nurses who work in home health care don't have to imagine that scenario. They live it every day.
Nice to see you again. I hope you slept well. I've got a couple medications for you.
Sue Halverson says she loves her job, mostly because she loves her patient, Eric Berry.
Listen to your heart. It's an honor to care for him. And your lungs.
The pictures hanging near Eric's bed show a strong, handsome graphic artist who lived a very independent life in Chicago. That was Eric's life before his medical emergency. What do you remember from that day?
Oh boy. That was probably the worst day of our life.
Eric's parents say a tangle of blood vessels in their son's brain ruptured, causing massive damage. Eric's dad just happened to be in Chicago on a business trip and found his son in the nick of time.
Kicked the door in on the apartment and found him on the couch, just hanging on to life. He was just barely hanging on. You know, from day one, after we got him stabilized and he was out of the hospital and in a nursing home, we had one goal. That was to get him home.
A little water to clear that tube out.
And that's where Sue comes in.
Typically, I'm here 3 days a week, 11 to 12 hours per shift, while his parents go to work. Paralyzed from the neck down, he cannot move any extremity himself. So he's full care.
How important is the at-home nursing?
It's everything. I mean, it's absolutely the most important thing. If we didn't have it, we couldn't have had him at home.
There you go.
But the Berries know firsthand getting nurses for their paralyzed son can be hard to come by.
We keep losing good nurses to nursing homes, hospitals. I mean, everybody can pay more than they can make, and sometimes a lot more.
The state has not adjusted some of its home nursing rates in more than a decade, and the adjustments it has made have been tiny. So since Sue started working with Eric 3 years ago, this 36-year veteran nurse has gotten a raise of 25 cents an hour.
I feel frustrated because I'm not getting the pay that I think I should deserve. A couple housekeepers I know make $25 an hour under the table, so there are no taxes. You know, here I'm at $19.25, and I'm taking care of a person and keeping them comfortable, and it just, I don't get it.
She does not want to quit home nursing, but she has thought about it.
Sometimes it keeps me awake at night. I'm single, I have my rent's going up. I had to borrow from my 401k just to make some ends meet. So that's the frustrating part.
Even more frustrating, the state's decision to not improve rates for home health care nurses is not just hurting the nurses, and it's not just hurting families who struggle to find enough nursing care. It's actually hurting the state, costing the Indiana Medicaid program more, not less, because without a home nurse, many patients end up right back in the hospital.
What happened?
She started having seizures. Right before we got to the hospital, she stopped right there. So they had to do CPR.
On this day, when we visited Taisha, Desire was not at home. She was at Riley Hospital for Children, where she's been in and out for months. Her mom is doing the best she can with all these machines, but there are times she just needs help.
And they said that she stopped breathing for like 5 minutes. So she lost oxygen to the brain. And I keep saying that, like, just what if, like, just what if a skilled nurse would have been there?
Desire's long stays in the pediatric intensive care unit can cost Medicaid hundreds of thousands of dollars, way more expensive than the cost of a home nurse.
They should raise the pay because we are suffering and our kids are suffering, and it's unfair.
That's exactly what one of the medical directors here at Riley Hospital tried to tell state officials last November. In this letter, Dr. Iona Cristea told state leaders families are suffering greatly due to Indiana's lack of home nursing services, which force parents to place their children in long-term care facilities. The doctor went on to say, in the last few years, at least 25 kids released from the hospital on ventilators did not have any nursing care at home, and that several deaths occurred because their parents were so fatigued.
I don't know what else how bad it's going to have to get.
Nursing agencies have for years been working with state lawmakers and Indiana's Family and Social Services Administration to try and address this problem, but without much success.
They'll tell you they're going to fix it. Don't worry, we'll fix it in the budget, or we'll fix it with the new rate methodology. And then they always keep telling you that, and then they jerk it back, so.
You've heard this before.
Oh, yeah. Yep.
One of the latest disappointments, a proposal this year in the state Senate that would have earmarked millions of dollars toward better pay for in-home nurses.
We had allocated $20 million for this. And unfortunately in conference committee, as things happen all the time in the budget, and that money was given to some other areas of the budget.
John Ruckelshaus is a state senator who knows a thing or two about the need for home nursing care.
I have a quadriplegic son. So yeah, it hits home.
Why is it so hard to get something done on this?
I think honestly, there's probably a handful of us that truly understand this issue on a personal basis. This is reality. This may not be the normal that they see on a daily basis or what they have been exposed to, but this is something we need to do.
Hopes for getting better reimbursement rates for in-home nurses have now shifted here to Indiana's Family and Social Services Administration, the agency that oversees the state's Medicaid budget.
The process, though long, is ongoing. It's not something we're doing in the future, we're doing it right now.
Dr. Jennifer Sullivan runs FSSA. She told me the agency has already asked Medicaid to approve a big increase for in-home nursing rates for respite care. That's the type of nursing coverage that allows Brenda and Brian Barry to leave the house and grocery shop or visit their grandkids while a nurse comes in to care for Eric. FSSA is also exploring options to improve reimbursement rates for other types of in-home nursing care, but it says a more permanent solution could take another couple of years.
Adjustments to the home health rates would need to be ready to propose for the next biennium budget, which would be 2020, the 2021 biennium budget.
What would you say to those families who say, we need this now?
I would say, well, first of all, we hear you.
This is ridiculous.
Families like these don't necessarily feel heard, especially when the state claims it doesn't have the money to give home health care nurses a raise.
Here we have a state that has money, has a surplus, and they need to use it. They need to use some of it on things that need to be corrected.
The state does have more than $2 billion in surplus, and 13 Investigates has learned a good chunk of that comes from FSSA, specifically unused Medicaid dollars that could have been used for home health care but wasn't. In fact, this year alone, FSSA gave back $182 million in unused Medicaid funds that went straight to the state's general fund to be used for things like highway projects and a new pig barn at the state fairgrounds. There's no indication any of that extra money will be used to help alleviate the state's severe home nursing shortage.
We have work to do, and we are actively engaged in the process to make sure that we make these services easily accessible.
But across Indiana, patients and nurses say home health care services are not easily accessible at all. In fact, this woman says the state refused to provide the home nursing care her doctors ordered, trapping her in hospitals and nursing homes against her will.
You waited 3 years to come home.
I did.
And the only reason she got home at all was not because of an order from her doctor. It was a shocking order from a federal judge who ruled the state violated her rights.
I get to live.
That part of the story in a moment. The state of Indiana is rated dead last in the nation for access to home health care, and state officials are well aware of the problem. If they didn't know before this year, well, they certainly know now. After a patient trapped in hospitals and nursing homes against her will sued the state and won. It's something we've all said at one point or another.
I'm home.
But to utter those few simple words,
I'm back home.
Few of us have ever had to fight as hard as Karen Vaughn.
Sometimes you think, why? Why do I have to fight so hard? Why don't they see that this is the right thing to do?
Karen's fight began when she was shot in the neck at the age of 18, and at that moment, paralyzed from the neck down. Since then, she's still lived a remarkably full and independent life, working, serving on community boards, and advocating for other people with disabilities. That lifestyle took a hit in 2016 when she developed pneumonia and had to go to Methodist Hospital. Doctors performed a tracheotomy to help her breathe, meaning she'd need more frequent nursing care. But what should have been a 1 or 2 week stay in the hospital soon turned into months, and then much longer than that.
How long did you stay at Methodist Hospital in 2016?
Till 2018. 2 years.
That's right, 2 years in the hospital, because nobody could find a home health care nurse to help Karen at her apartment.
They don't have enough nurses. They don't have that for anyone. They don't pay enough.
At one point, the hospital told Karen she'd have to leave. After all, it's a hospital, not a hotel. And doctors were convinced Karen didn't need to be here, that she could live comfortably at home with nursing care that Medicaid was willing to pay for. But since there were no nurses willing to work in Karen's home for what the state was willing to pay, Karen was instead sent to a nursing home, where she developed horrible bed sores and infections that put her right back in the hospital. When Karen recovered, nursing care still wasn't available, so she was sent to another nursing home.
Against my will.
This time, more than an hour from her family and friends.
You just wanted to be able to come and live your life at home.
I wanted to live a life. I wanted to have a life. You don't do that when you're in a facility. You don't live there. You exist.
At that point, Karen filed a lawsuit in federal court, claiming the state of Indiana and FSSA were essentially holding her hostage in hospitals and nursing homes. The chief U.S. District Court judge agreed and issued a scathing order that said FSSA failed its moral test to care for the state's most vulnerable citizens. The judge wrote, FSSA is stuck in a bureaucratic quagmire that even its own employees couldn't explain. And the agency discriminated against Ms. Vaughn, arguing it could essentially set its own reimbursement rates so low that individuals on Medicaid would all be forced into nursing homes. And Karen's favorite part of the judge's ruling:
if the defendants will not act to protect Ms. Vaughn and her civil rights, then the court will.
That's a pretty awesome judge.
When you first heard the news about the ruling, what went through your mind? What did you think?
I get to live.
The federal court ruling came in January. Karen moved back into her downtown apartment a few weeks later, and FSSA is now legally required to ensure she has home nurses round the clock. It helps to ensure someone is around to clear Karen's breathing tube whenever it gets blocked, something Karen can't do by herself since she's a quadriplegic. It's a clear victory for Karen, but a bittersweet victory for a couple of reasons. First, Karen thought her court case would mean other vulnerable patients would now also get easier access to home nursing care. But after learning about families like these, she now realizes FSSA has not yet changed anything at all.
It breaks your heart. How can the state of Indiana justify doing to their families what they do? How? Why?
And second, Karen's court victory might be short-lived. FSSA is now appealing the case, meaning the state might not have to ensure that Karen gets home nursing care after all.
Why is FSSA appealing that ruling?
Unfortunately, on this particular case, I can't. It's an active litigation, so we can't make public comment on active litigation.
For families across Indiana, the appeal makes them question whether the state is really serious about providing better access to home nursing care, and whether those at the top are really listening, whether they even know about this daily struggle for survival.
They desperately need this care that they can't get.
They certainly know now. My chat with the governor is next. The waiting lists for home health care in Indiana are growing every day. Both families and nurses say the system needs major change, and they want to share that message with state leaders who can make a difference. The problem is, it's hard to share your story when you can't even leave your house.
I was afraid what those men would do to you.
At the Sterrett home in Delphi, Indiana, just about every day is movie day.
Looks like I'm still a deputy, don't it?
It's one of Josh Sterrett's favorite ways to pass time. And for Josh, time is a blessing.
They said life expectancy was maybe 18, and he's now 39.
He was diagnosed with Duchenne muscular dystrophy as a young boy. It's a cruel, uncurable disease that weakens muscles all over his body.
He can't take deep breaths. He can't cough. So we have to suction him. It's not that taking care of Josh is hard, but there's a mental strain, because you can't be more than a room away.
Sitting on the couch talking with me is about the most time Shirley and Luther Sterrett will get to spend together all day. Shirley leaves early in the morning to deliver mail for the U.S. Postal Service, while Luther takes care of Josh. As soon as Shirley gets home, Luther heads out for his night shift at Subaru, and then it's Shirley's turn with their son. And if they're lucky, a home health nurse will come to give a helping hand, so Shirley and Luther can each get at least a little bit of sleep. They're supposed to get 92 hours of home nursing care every week, but they don't. Just not enough nurses to cover all those hours. And when nurses are scheduled, they can't always make it.
What happens when a nurse doesn't show up?
You're the nurse. Luther will work all night, stay up with him all day, and then he'll go to work that night. So he goes without sleep all that time. Yeah, that's the way it is. You miss work or you go without sleep.
And it happens frequently enough that Shirley has burned up all of her vacation days, and personal days, and sick days. If she were to take another day off this year, Shirley worries she'll lose the job she's worked for more than 30 years.
I need my dental surgery. I can't do it. I have cataracts. I need my cataract surgery. I can't do it until I retire because I'm out of time. It's not like we don't work. We both are trying to earn a living here. We're both trying to be productive citizens and all of that, and we need help.
The help the Sterrett family does get, they're very grateful for.
My name is Doris Kreitz. I'm a home health nurse.
And Doris has lots of experience.
I'm 85 years old, so I've worked my entire life in nursing.
She's one of the closest skilled care nurses to the Sterretts who's available to work the hours they need. Her daily commute to Josh's house, 85 miles.
It is quite a ways. It takes about an hour because I live out in the country, but I don't mind the drive.
If she does not make that drive, well, tonight,
hello,
Josh would not have a nurse.
Hey.
That's just how it is in rural communities across Indiana, where the state's home nursing shortage is even worse than in the cities and suburbs.
Okay.
The good news for the Sterretts, so far, they've been able to find a way to keep Josh at home. The bad news? A severe home nursing shortage means for years, they've been trapped at home with him.
Imagine not being able to walk out your front door. Imagine not being more than 2 rooms away. It's hard. I would love to be able to go out and plant some flowers, but you don't get to go outside. You don't get to do that.
Other families are in the same position.
We haven't had a date night since May.
It shrunk the area of our world. We can't travel.
Making it to the state capitol is not easy for these families and nurses, but they hope state lawmakers and decision makers might still hear their voices anyway.
I want them to understand that it's important that we need the funds for these nurses because without them, we are suffering and our kids are suffering.
If the field was leveled up just a little bit, it would help.
They have the power to make the difference in lives.
The governor keeps saying he wants to put people first, and this is his chance because these kids and families are in crisis.
They desperately need this care that they can't get.
We took all of their concerns, all of their stories, directly to the governor.
Our administration absolutely cares about this home health care desire for every Hoosier.
I asked him about the $182 million in unused Medicaid money that his budget office just reverted back to the general fund. Would he consider using that money to help provide struggling families with more home nursing care?
We do have funds that could be allocated in areas of high need. We just need to know the exact people and make sure that we're shepherding them to the right resources if they're available.
The state does have plenty of resources. State officials who say they want to help.
That's what we're here for.
Lawmakers who want to help.
We're going to keep fighting.
Nursing agencies on standby to help.
Our patients can't wait.
Indiana also has a pile of surplus Medicaid money that could be spent any way state leaders want.
The state has the money.
And a federal court ruling that says the state has an obligation to provide access to home nursing care for those who need it.
They know what's right.
And yet, what Indiana still does not have, enough home health care nurses. And without a plan to attract and adequately pay nurses to work in homes, this crisis facing thousands of Indiana families is not going away.
We're not professional healthcare people. We're just parents that love our kids.
Nursing is vital for these kids to have a safe and normal life.
You have to have help. You can't do it alone.
And right now, you're doing it alone.
Yep. You want to sit up? Daddy wants to sit up. Oh, Daddy wants to sit up. See who is that? See who is that, Mama?
They can't leave home, but they would love for you to be able to see what they deal with every day.
Sure.
Would you have any interest in
I
joining
would,
some
and
of
that's
those
how
families?
we're best informed, and that's what this administration does each and every day. Absolutely.
I'll be in touch with your office. I would love to hook you up and get
Thanks.
you some names of some families.
I would appreciate that.
Whoa. I'm glad it's nice.
That made my day. Yeah, you're laughing. I hear you.
Oh my gosh.
I know, see?
Eric, baby. This is what muscular dystrophy does to you. See his fingers?
Yeah.
And of course, he can't move his fingers. He can't turn his head. He can't nothing.